Hello, good evening. It's Dr. Chidi Ufundu of Snowspirations Global Health Solutions. Thank you so much and welcome to today's open clinic. Today we're going to talk about premature or preterm labor, which will lead to preterm birth. What is preterm labor? What is premature labor, which will lead to premature birth? We can also incorporate premature contractions. Premature contractions, premature labor, and preterm birth. What is it all about? What are the major factors? What are the major facts you should be conversant with as a woman expecting to be a mother? Very important clinic. So please quickly rally, announce your name, announce your location, and we're going to run about 30 minutes and we switch to our Facebook. This topic is more important to all pregnant women. So if you're currently pregnant, it's important you pay attention to the facts, to expectations, to things you should be on the lookout for. Because what happens in science, when something happens and we track it down, we can actually prevent it from happening again. So there are some aspects of preterm contractions, preterm labor, and preterm birth we can do something about in regards to prevention. However, if it has already started, we are just at the mercy of God. So let's get started. So what's preterm labor? You see, labor is the process that will start the initiation of giving birth to your baby. Now, any labor or any contraction that happens before 37 weeks, 37 weeks is called term. When you carry your pregnancy up to 37 weeks, you are considered term. Term means your baby is good to go, as in your baby is fully formed, the organs are good. If your baby it's to be born, your baby will be certified okay, and you can go home. So any contractions, any labor that happens before 37 weeks, it commonly happens around the 20th to 37th week. So we want all pregnant women to at least get to 37 weeks. Now, during the process of premature or preterm labor or preterm contractions, your womb will start getting tight, will start feeling hard. That's actually the contraction itself. When this is happening, there will be changes in the cervix. Remember that your cervix is the junction between the womb and the vagina. So when women are contracting before they are expected to contract, there will also be changes in the cervix. When this happens without intervention, your cervix will continue to open and ultimately your baby will be delivered. We don't want that to happen. Now, when you get to 37 weeks, we want all women to get to at least 40 completed weeks. So babies that are born from premature contractions or preterm contractions or preterm labor are called preterm babies. So any baby that didn't get to 37 weeks, when that baby is born, the baby might have a couple of challenges. They might have breathing problems. They might have eating problems. They might have problems of keeping themselves warm. So we want to prevent this as much as possible. Now, if this is not controlled, you will eventually give birth to the baby. And the earlier it happens, the more the possibility the baby will not survive. So in America, preterm delivery of the baby is actually the leading cause of death among newborns. So if you have a facility that can manage babies that were born before 37 weeks, so many babies will have a chance. But if you don't have a facilities that can manage preterm babies, the name of the facility is called neonatal intensive care unit. The possibility you're not going to have good outcome is very high. Now, it's important we have clinical diagnosis of preterm or preterm contractions or preterm labor. You are not supposed to be the person that will diagnose this. You go to the hospital, your provider will check and assess your cervix and make sure everything is all in tandem. Once we confirm you are in preterm labor or preterm contractions, you will be admitted immediately. Then we'll begin our conservative management. Globally, less than 10% of women who might have preterm delivery might actually have consequences. So it's important we do everything within our power to limit the occurrence of preterm contractions. So what are the likely risk factors? Now, women that carry more than one baby, so all the women that want to have twins, triplets, quadruplets, the possibility you might be a candidate that might have preterm delivery, preterm contractions, preterm labor is very high. So the more babies you're carrying in your womb, the more the likelihood you're going to be predisposed to having preterm labor. So that's a known factor, carrying twins. Now, as of today, we don't know exactly what leads to preterm labor, preterm contractions. Remember, there's a difference between risk factors and causes. We might have some attendant risk factors to having your baby come early, but no one can tell us that this is exactly what will cause preterm labor, preterm delivery. It's grossly unknown. Now, sometimes you will check up and down and we will not find anything. Now, what are the warning signs? What are those signs a woman that is pregnant will see and she will begin to worry? What are the warning signs? Number one, womb contractions. You should be conversant with this. As a pregnant woman, when you go for your ANC, we'll teach you a couple of things. Now, if you notice that your womb is tightening and it's hard and you feel kind of discomfort and it happens more than 6 times in an hour, it's possible you're having contractions. Now, when you are having this, you will begin to feel the same cramp you will likely feel when you are bleeding. That crampy feeling in your abdomen that may come and go, it might not be there constantly. It might just come in and go. But if you begin to experience this frequently, more than 6 times in an hour, please ring your doctor, go to the hospital immediately. It's possible you are having contractions. Now, some women might notice low, dull ache at the back, low, dull backache, which you can feel above your waistline and it can come and go. Sometimes it will be there. Now, some women will feel pressure, like your baby is gonna come. These are a couple of presentations that might tell you you're in labor. It doesn't mean you're gonna present like everything. Some women wouldn't even know they're in labor. Now, some women will have abdominal cramping. Some women will have diarrhea. Some women will not have diarrhea. Some women will notice increase in the discharge from the vagina. There might be some blood in it. It might be clear. It might be stretchy. These are all things that might tell us you might likely be going into preterm contractions, preterm labor. So if you are currently pregnant, there are 3 things that should give you a lot of concern. Any sign of blood, any water coming out of your body, and pain. So if you notice all these things I've mentioned, please ring your doctor. And nobody should give you an appointment less than 24 hours. Carry yourself. Go to a good hospital. We will normally give first-class treatment to pregnant women. We need to check you. We need to check your cervix. We need to confirm you're not pregnant. And remember, the closer you are to 37 weeks, the better. The farther away you are from 37 weeks, the worse. So if a woman starts having preterm contractions at 20 weeks, that's a very, very deadly sign, because the possibility you're going to hang in there until you get to 37 weeks is really limited. But if a woman begins to have preterm contractions around 34 weeks, 35 weeks, 36 weeks, there are a couple of things we can do conservatively to buy more time. Now, how will you tell what it's normal? You see, if you have more than this tightening, more than 6 times in an hour, there's a concern. Now, generally, all pregnant women will feel contractions. When you change your position, when you're sitting, when you're standing, you will feel a couple of twinges here and there. But if you monitor yourself and you've noticed this for 6 times in an hour, please ring your doctor. Now, most times when all these things are happening, your cervix will begin to open. Your cervix is not supposed to open until you're fully ready. Once your cervix is opening, the possibility your baby is going to be delivered early is very high. Now, since in some women, labor might be silent. Some women won't even know they're in labor. And before you blink, the baby is already out. We need to be mindful. How do you know if you are in this type of labor? You place your hand, your fingertips on the pregnant womb. Then you keep it there for some time. You will feel some periodic tightening and hardening when you place your hand there. You will feel it yourself. Now, if your womb is contracting and you will feel it by yourself, and it happens more than 6 times, my sister, you are likely in labor and you need to be in the hospital. The best place to be if your baby is going to come early is in the hospital, because there are a couple of things we can do differently. Now, management wise, what are those things we can do if this has already happened? So assuming you get to the hospital and it's confirmed that you're in labor, what are we going to do? First of all, we're going to admit you. We're going to make sure you're calm. The more you're freaking out, the more you're worrying, the more you're thinking, your blood pressure is going to be going up. Your stress level is going to be going up. You're not going to be helping your baby. So relax. The best management of preterm labor, preterm contractions, preterm birth is to administer a single course of a drug we call corticosteroids. Steroids. Why are we giving these steroids? Because one of the important organs in the baby that must function before the baby can survive outside the body of the mother is what? The lungs. So if a baby is not up to 37 weeks and the baby wants to come before time, we must give a single dose of what we call steroids. The commoner one is what we call betamethasone or dexamethasone. So if you have seen your doctor, please discuss all this with your doctor. We have noticed that when we give this, it gives us adequate time. Normally, these steroids are recommended between the 24 weeks to 34 weeks. 34 weeks is naturally when the lungs of the baby will mature. So when we give the baby these steroids, it will help in development of what we call surfactants. Surfactants are what will help the baby's lung to perform optimally. So when we administer this, it's kind of helpful. Now, some women, based on previous history, so if all your previous pregnancies, you had preterm delivery, this possibility that subsequently you're going to have another preterm delivery is very high. So we can give it prophylactically. We can give it as an intervention. When we do this, we notice that it helps to make sure that the baby outcome is good. It helps to limit infection. It helps to limit brain bleeding, infections, and inflammation in the baby. So steroid is protective. Now, some women will also be given what we call tocolytics. Tocolytics are like prostaglandin and calcium blockers. So some people will give you what we call salbutamol. When we are giving you that, it's helping us to buy more time so that the baby will stay for more time before we begin to think about what we're going to do for the baby. So these are things we will do that will help the baby. Now, you see, it's not just enough to be pregnant and have your baby. Anything that happens in the body of the woman can affect the brain development of the baby. So we want to be careful. So use of steroids is the adequate, proven, evidence-based drug we can use to buy more time until the baby is saying, no, you know what, I'm done, I'm going to come. Now, what about prevention? What are those things we can do to actually prevent preterm labor? Definitely register for your ANC. Every pregnant woman in this community must register for ANC. When you register for ANC, we be on lookout for risk factors. We ask you a lot of questions. We keep an eye on you. Now, if you have had preterm baby in the past, if you have had preterm delivery in the past, we will give you what we call prophylactic progesterone. Remember that progesterone is the pregnancy protecting and promoting hormone. And we notice that women that have lower level of progesterone will eventually miscarry the baby. So if you have had preterm birth in the past, preterm contractions, preterm labor, we will give you progesterone ahead on time. Vaginal progesterone. Now, some women will have what we call short cervix. If we also, in course of coming for your ANC, we discover you have short cervix, we'll also place you on progesterone. Now, some women will also be placed on cervical sacklage. So if we notice that the length of the cervix or you have cervical incompetence together with the previous experience, then we're going to give you prophylactic cervical sacklage. What cervical sacklage? Will tie the neck of your womb at the cervix to make sure that your baby will not escape from your body. So these are the facts you should know about preterm birth, preterm labor, and preterm contractions. Now I'm going to open the clinic. Please feel free to ask your questions. Immediately after this clinic, we'll have another repeat clinic in our Facebook page. Okay. So admin, thank you so much, Kenneth. Thank you, Tosi. Please feel free to ask me your questions in real time. If you know anybody that is currently pregnant If you know anybody that has previously had preterm birth, preterm contractions, preterm delivery, please share this video with them. If today is the first day attending my clinic, I normally show up on Tuesdays about this time, 6:30 p.m. Then immediately after this, I go to Facebook, then we round up. Then on Saturdays, I come in a little bit early. So if today is the first day attending my clinic, thank you so much. I appreciate you. But it's time for questions. Please start asking your questions. And do you know the funny thing? The regular people that attend our clinic don't even need our services. COO has completed her family. At least for now, Tosi is not expecting a baby, but she attends all the clinics. Now you'll be wondering, where are the women that should actually be in this clinic by now? Where are they? Okay. Can preterm contraction stop on its own? Yes. Now, hopefully, you might have what we call pretentious labor or Braxton Hicks. So if the type of contraction you have is not really the real labor, it's not really the real contractions, it can stop by itself. Now, is that the real labor? No. But once labor starts, nobody can stop it. But if you have the pretentious, false, fake labor, Braxton Hicks, it's just like a trial labor. It's going to stop on its own. Now, be very, very careful. You are not the person that will be at home to know if it's Braxton Hicks or real term or real labor. You have to go to the hospital. So if it's not what we are thinking, it can stop by itself. But if it's real labor, it will continue until your baby comes. Labor is a very, very forceful process. Once your baby is good to go, your baby is good to go. Nothing can stop your baby. Okay, good evening, doc. What's the benefit of taking aspirin during pregnancy? Beautiful question, Tosi. So here's the deal. Aspirin over time, especially low dose aspirin, we've noticed that it can help in preventing a couple of complications that can happen in pregnancy, especially women that might have hypertensive predisposition. So we notice that some women, when we give them aspirin, it will prevent them from having preeclampsia, eclampsia, and other hypertensive complications in pregnancy. So it's not for all pregnant women. But if we notice, if you have a risk factor which might predispose you to having complications, we give you low dose aspirin to protect you and your baby. That's the major reason why we give aspirin in pregnancy. Not everybody will have it. Now, is short length of cervix hereditary? Now, I will hazard on the side of yes. You see, somehow, whatever your mom had, you're going to have. Somehow. Whatever your sister had, somehow you're going to have it. Now, does it really have genetic predisposition? I will hazard a guess. It's still an evolving, case study. So we don't know for sure, but I will hazard a guess because there are so many things your mom will transfer to you, and there are so many things your dad will transfer to you. So most of the things that might not be good that your mom will transfer to you, you're going to inherit it. Let me give you an example. If your mom had a menopause early, in the 40s, the possibility you're going to have your menopause early is very high. If your mom had a menopause in the 60s, the possibility you're going to have your menopause in the 60s is very high. If your sister had anything gynecologically, the possibility you're going to have it is very high. If your mom had fibroid, the possibility you're going to have fibroid is high. If your mom had any type of cancer, the possibility you have cancer is very high. So the answer is yes, to an extent. Okay? All right, guys, please keep asking your question. This particular clinic is structured to help pregnant women, and we have ample time, about 10 minutes. So please still keep asking your question. I love the two questions from Kene and Tosi. Beautiful questions, okay? All right. It's the probability of repeat preterm labor high in subsequent pregnancies. Yes, Kene, 100%. If you have experienced preterm labor in the past, and we managed to deliver your baby, guess what? You are now considered very high risk. Now, compared to other concomitant factors, so assuming you're 35 years and above, assuming your BMI is above 30, assuming you're hypertensive, assuming you're diabetic, and you added a lot of body weight in pregnancy, and you previously had a baby that had preterm labor and preterm contractions, the possibility that subsequent pregnancies you will have the repeat is very high. So you can come into a family, you might see a baby that was born at 31 weeks, and you will notice that all the siblings that will come afterwards will be revolving around that 39, 28, 29 weeks. So the answer is yes. That's why we need to be on the lookout. So once you've had something happen to you in medical practice, we keep it as your history. So some people will wonder whenever they come to us, we ask them a lot of questions. What is doctor doing with my mother's history? What's doctor doing with my father's history? What's doctor doing with what I did 20 years ago? Because from your history, we can know your risk factors and we can tailor towards avoiding them. So Kenneth, beautiful answer, beautiful question and beautiful answer. I love that. So the answer is yes. Okay, guys, keep asking your questions. Please invite all pregnant women. You see, we structure our topics to suit our population. This particular topic came in because one of our members in our ANC group actually had this case. So I have to extend it to everybody. So this is a caring community. Anything we know that will benefit anybody, we share it with everybody because we want you to be happy. We want you to be pregnant. We want you to have your babies in your hands. So please ask your questions. Share this video with people that it will help. Please practice it. Please, if you're pregnant, this is not the time to play games. Have an experienced doctor by you. Please, observe all protocols, especially you are going to have your rainbow baby. But unfortunately, if you repeat what you did in the past, you will likely have an extended time until you have your rainbow baby. Who can tell me what a rainbow baby is? Except Kene and Tosi, the next people in the clinic, if you can get the meaning of rainbow baby correctly, Kene, please shortlist them to the upcoming masterclass in gender selection. I need to know what a rainbow baby is all about. If you can get it correctly, you will attend our masterclass free of charge. But please keep asking your question. What's augmentation of labor? Tosi, it looks like you're planning to go into medical school. Now, sometimes if labor is not proceeding the way we want it, or if labor is arrested or labor is delayed, we can augment labor. Augmenting labor means we can administer things that will lead to more labor. So naturally, labor is a natural process. When your baby is good to go, your baby is good to go. But if we notice that you're not dilating, if we check your cervix and the expectation is that to an extent, within 24 hours, your womb will open, your cervix will open, your baby will come, you will get to the stage we'll tell you to push. So if we notice that your contractions are not strong enough, we can augment. So augmentation means we can give you some more things that will help you to push, that will help you to push out that baby. That's called augmented labor, supported labor. On the other hand, if we know fully well that the woman is ready, the baby is ready, the labor is refusing to come, we will go for the opposite, which is induction of labor. We start labor by ourselves. There are so many ways to do that. So augmentation means you've actually started labor, but it's not proceeding properly, and we want to make it to be forceful. Very beautiful question. Tosi, I love that question. When something negative happens, your body language from what you're presenting, you are already saying, oh, sacrilege was placed without any diagnosis. Sometimes we suspect. Sometimes we give you sacrilege from a preventative point of view. So the reason why your provider gave you sacrilege at 16 weeks was because he was probably worried that you might have miscarriage, or maybe that your cervix is not stable. So it's not only women that have confirmed cervical incompetence we give cervical sacrilege. If a woman keep losing her baby up and down, we're going to do everything possible to keep that baby. So sometimes we give you even abdominal sacrilege. Now, are you going to require sacrilege for the rest of the other pregnancies? Yes. And it's painful. I mean, you have your pregnancy through IVF. It's painful to go for IVF. You succeed and you become pregnant, then you have miscarriage. It's really, really painful. It's not that any miscarriage is not painful, but IVF, you spend a lot of money. They took your belly, they took your tummy, they took your thigh, and at the end of the day, you miscarry the baby. Very, very, very painful. Now, how can you avoid subsequent problems? Get a good doctor. I don't know if you belong to our group. I wouldn't want you to, think you can figure things out, because the problem is so many people want to figure things out by themselves. So many pregnant women are smart. They think they can run throughout the whole pregnancy without a doctor. Then suddenly they need a doctor, and suddenly they begin to run up and down. Retain a doctor. The moment you are pregnant, the moment you check your urine pregnancy test, you retain a doctor, a doctor that will give you recommendation for your blood test. Once your blood test is positive, the same doctor will tell you to go for your ultrasound. Once you confirm that the pregnancy is okay, then you retain that doctor. Why should a pregnant woman retain a doctor? Because a doctor is your biggest friend in your pregnancy. A good doctor can save your baby. We have saved so many babies in our group by simply telling them to go to the hospital, by simply telling them to stop or to continue. Why? This is what doctors do. We save lives. So retain a good doctor, not just anybody, any type of doctor, an experienced, caring, compassionate doctor. You see me? If my COO tells me, hey, doc, someone is, doing this by 1 a.m., 2 a.m., I will call that person because we cannot wait. This is the kind of group we belong to. Once you are in danger, you can count on us. So you need to retain a doctor. You have access to the doctor. You have the doctor's phone number. You have easy access to ask your questions. That's what you can do. When you're pregnant, we go through the journey of your pregnancy until you have your baby in your hands. Okay? All right. Correct. Stella Maris Ujunwa, you got it correctly. Maybe you use, I don't know, maybe you use Google. But so Rainbow Baby, it's a baby you will have after losing your baby in the past. So all the women that might have miscarriage, ectopic pregnancy, missed abortion, chemical pregnancy, and embryonic pregnancy, if you go ahead and become pregnant later and have your baby, that baby is called a rainbow baby. So you got it correctly. Admin, please shortlist this. I think Stella Maris got it correctly before AGK Gloria. You can actually shortlist 2 of them if they have a need, okay? A rainbow baby can be seen as a baby born after previous. Correct. Both of you got it correctly. Do you guys still have more questions? I have 3 more minutes. 3 more minutes. Now, for the month of October, guess what we're doing? We're going to go big. Last month, we went big. We went to multiple pregnancy. Guess what we're going to discuss this month? Gender selection. This one is going to be big. Now, we understand there are so many wars in so many families. So many families are not peaceful because they want boys, they want girls. Your partner is blaming you up and down. We are going to go there. On the 30th of this month, we'll have a super master class on gender selection. Go and save that date. 30th October, 9 p.m. Nigerian time. Make sure you bring that your man. Bring him. Let's talk about how we can help each other. Okay? All right, guys. Okay. You lost your twin babies. Stella Maris, I really empathize with you. It's really painful. But what are you doing differently? When did this happen? Do you have a doctor? Are you a member of our group? Do you have a package? Do you live in Nigeria? Consider getting a package. You see, when something very terrible happens to you, you have to go above and beyond to refuse to allow that thing happen to you again. And my sister, right now they've given you sacrilege and you had, that outcome in your baby through IVF. You went for IVF and you succeeded and your twins, got miscarried. It's painful. So if you're gonna go again, go please with a doctor. I know you might have your doctor. I'm just giving you an extra lift, okay? So I understand how it feels to look for your babies and your babies are not there. I've been there before. So guys, does height have any impact in giving birth vaginally? Not really. But height can contribute to your BMI. How do we calculate your BMI? Your height and your body weight. But generally, there is no implication of your height and giving birth vaginally. What would determine if you're going to give birth vaginally is what we call pelvimetry. Do you have adequate pelvis? Do you have adequate fats in your hips to give birth to your baby? Do you know that some women that are underweight cannot give birth to their baby because they accept their pelvis to be contracted? They cannot be well expanded for the baby to come out. So those women are going to be delivered through CS. So if you're going to gym and you're jumping up and down, be careful. We don't want you to lose a lot of weight. We want you to still retain your fat so that you can have your baby. You live in Ghana, okay, so Stella, if you live in Ghana, you're not qualified. The only people we can attend to consultation-wise are people that live in Nigeria because our group is incorporated in Nigeria. So if you're in Ghana, then retain a very good doctor in Ghana, okay? All right. Can a fibroid patient take folic acid? 100%. The problem is not whether you have fibroid or not. The problem is what type of fibroid you have. So whether you have Mountain Kilimanjaro size of fibroid, it doesn't matter. You have to take your folic acid. I know the theory out there is called a theory. It's called a hypothesis, not a theory. Oh, if you have fibroid, you don't take folic acid because it's going to make it to be big. No, it doesn't make sense. If your fibroid is significantly big, you remove it. The danger of not taking your folic acid, you cannot even begin to imagine that. So imagine giving birth to your baby and the back of your baby is open. Your baby has what we call spinal bifida. Will you want to have a baby that will be compromised because you're not seeing your fibroid and you're not taking your folic acid, which you're supposed to be taking? So it doesn't matter what you have. What you should do is to go and look for a good doctor. If your fibroid needs to go, we remove it. But every woman that wants to become pregnant, admin, please share the formula. Share the quantity of folic acid you need. 400 to 600 microgram of folic acid, which should be in your prenatal vitamin. Every singular woman that wants to be a mother, once you begin to make love with your partner and you want to become, you have to start taking it immediately. And you must start, especially before 3 months of pregnancy. Then you take it for throughout the duration of pregnancy. It's protective. The protection that folic acid will give you and your baby, you can't even begin to imagine. The danger it will cause you if you don't take it, you will not carry it with your heart. So please take your folic acid, every singular one of you. Okay, so Gloria, follow admin. Make sure you send us email and we go from there, okay? All right. Stop nursing your fibroids. Let go of your fibroids. Let your providers decide if your fibroid is significantly big. We most times worry about fibroids that are located inside the womb, bigger than 6 cm, and giving you a lot of symptoms. If you have those type of fibroids, then please go and remove them. Follow your doctor. I'm sure so many of your doctors have suggested surgery, but you're so afraid. Doc, I heard that my friend did this and she died and all that. Your friend is your friend. You are not your friend. No two people can be the same. Okay, so guys, my time is up. Thank you for coming. If you are in our Facebook, please join us in our page and we continue our conversation. Make sure you subscribe to this group. Share this video with anybody you know that is pregnant. First trimester, second trimester, third trimester, it doesn't matter. Share it with everybody. Matter of fact, anybody that wants to be a mother should know about this. So share this video liberally, make it go viral. Share with anybody that wants to have a smooth experience in their pregnancy. Can we all appreciate admin? Can I thank you so much? Tosi, thank you. Stella, Ejike, Gloria, and Kate Adane. Thank you guys for coming tonight. We appreciate you guys. Please join me on Facebook while we continue the conversation. Thank you, and I'll see you shortly. Bye-bye for now.